Good afternoon, everyone, and thank you for joining us for today's session, using Cubiko to transform patient care and financial sustainability in general practice. My name is Rochelle. I'm an Education Officer for the Primary Health Network. Before we begin, I'd like to acknowledge the traditional custodians of the land in which we all live and work on. I'd like to also pay my respects to Elders past, present and emerging, and extend that respect to any First Nations people joining today. Just before we start, I want to mention a few things. This session today will be recorded. At the end of the presentation or throughout the presentation, we'll have a Q&A, so please feel free to pop your questions in the chat box. And lastly, your feedback is extremely important as it helps support us to provide future education sessions. So I'll pop a link and a QR code to the Slido evaluation in the chat towards the end of the session. Now, unfortunately, Nick is unwell and not able to present today, but we're very grateful to Chris Mead, founder and CEO of Cubiko, for stepping in such short notice. He'll be presenting alongside Jessica Harrison, Cubiko's Customer Success Specialist. So with that, please help me in welcoming them both, and over to you.
Hello, everyone. Thank you for having us here to present today. Very excited to be talking to you. I'm showing my screen, as I said, jumped in the last minute, but loved everything that we're going to be talking about today. Want to start off by making sure you can all hear and talk to me okay? In the chat, can you type Y if you're a Cubiko customer or N if you're not? Y if you are, N if you're not, because then we can make sure we help tailor this content to deliver what will be useful in the chat. So I can see Karina is typing. You get those 3 dots there typing. No from a Karina. A nurse is typing. Or let's wait and see what comes up there. Very exciting. Always feel like I'm calling the races when we do that section in a webinar. It's like, oh, it's coming around the corner. We've got this one coming through. What are we going to have a chat about today? Look, it's trying to meet everyone's objectives today, because we do have some Cubiko users and some non-Cubiko users. But the awesome thing is we're all from this wonderful world of general practice. So we're going to have a bit of an overview about what Cubiko does and some of our history and how you can actually use Cubiko to get the most value out of it, particularly with permissions and a bit of setup things there as well. Then we'll jump into the really cool stuff that me as a general practice data nerd totally love. How can you use Cubiko to support your practice? I know margins get tighter all the time, so we need to be things across our patient, our utilisation, our sustainability, and balancing that all with patient care. We're all in this, hey, Jess, to look after our patients. And also we'll give you some links to some awesome resources and some takeaways that you can share with your team. Because if you're like me, being able to take stuff back and share it with your team, super, super useful. As mentioned, Jess and I are presenting today, and I hit Jess on the spot this morning and said, Jess, you are from this wonderful world of general practice. I want a photo. And Jess shared this photo with me. So Jess, maybe you introduce yourself first up.
Thanks, Chris. Yeah, so my name's Jess. Before joining Cubiko, I was in general practice as well. I've worked in medical practices for about 13 years. So from reception to 2IC through to a practice manager. So I've spent a lot of my, adult working life in medical practices. And I guess kind of sharing that knowledge, with my customers and you guys, with education and Cubiko. So I would have been I think super appreciative if I had Cubiko when I was in clinic, because there's so much goodness in there, which I will take you through today. And I'm sure I'll mention which ones are, my faves. But yeah, so excited to share with you guys today.
That's awesome. And hey, everyone, my name's Chris. I was a practice manager for 10 years up here in Brizzy, and I do have an embarrassing photo to share. This was me on my 3rd day in working in general practice. So no one on the call take a screenshot of this. I have had people thread to that before. We were renovating our practice to make a new consulting room. So my practice manager's office got moved to being in the tea room. So that was me in my tea room. I studied accounting, graduated as an accountant, and realised I did not want to be an accountant. And so went to start working in a general practice. And I can admit, and Jess, she's heard this before, I had no health experience. And at the end of my 3rd week in general practice, this is me and our amazing reception team. 3 of our 4 receptionists got sick, so I got chucked onto the front desk. And hey, that was learning general practice by fire. I had to learn everything. I didn't know anything about MBS billings or codes or things like that, or how to even scan or acquire documents. And so I started to get to know general practice and ended up working in general practice for 10 years. And the reason I'm telling this story is not to chew up your time, but it's to tell you that the reason Cubiko exists is because we built dashboards in our practice. And you know what? We got it wrong. And I think when I talk to people about one of the magic things we do in general practice is that we look at what we do and we do the good old PDSA, plan, do, study, act. And so we build dashboards in our practice and dashboards, some of them like you'll see today, but they were the wrong dashboards. They'll focus on the wrong things. And that's where I got really passionate about what data can do in general practice. And so eventually we built Cubiko and we launched 5 years ago. And I am super lucky that we now work with 2,750 practices from all over Australia. And I was just saying to the crew before we started today, I think I have one of the best jobs. I get to hang out with general practices and talk about data all day, every day. That's a pretty cool gig. So we started doing that one, and we now work with so many practices from all around the country. If you're new to Cubiko, I know there's a few people new on this call. What does Cubiko do? Cubiko takes data from your practice management system. So you can see data here for best practice, medical director, if you use ZMed, and we take data from other sources as well. So you don't have to have these ones, but the primary source is your practice management system. And then we combine it with some other data from maybe the government and things like that to give you really insightful dashboards. Really insightful dashboards to make running general practice easier. And I think one of the big things that I was really proud of and been really passionate about since we started the company is that showing you data and showing numbers is all good. But if you can't do anything with it, it's a bit like, oh, why did you tell me that, Chris? You're actually just making me feel bad. How can we use this data to do something better with it? Is such a better way to use data. Otherwise, everyone's like, oh, another report. Who's ever had that in their practice that they printed off a report or a PDF or something and said, this is what's happening? And then people have been like, yeah, but what do we do with it now? Maybe check in the chat if you've had that before, because that's what we had a lot in our practice. So we started building dashboards to understand what was going on. And eventually those dashboards got used by so many practices. And we now have dashboards for everyone in the practice. And not just dashboards, tools. So we have things for your GPs, things for your nurses, things for your allied health workers or your reception team. Have a lot of things for practice managers and practice owners, and then other people who might interact with you, maybe community health workers or third-party accounting teams. Lots of different people that Cubiko can support. Why do they use Cubiko? Last slide, I promise, before we get to Jess with the good stuff, is because I love it. We take the data from Cubiko and your practice management system, and the number one thing we focus on doing helping is high quality patient care. We're all in this because we want to care for patients. And I often say, and you can see my second picture there as a set of scales, because we're balancing looking after our patients with keeping the doors open. And a really amazing GP, one of the first GPs that ever worked with me, said to me, Chris, we can't look after anyone if the doors are closed. We can't look after anyone if the doors are closed. And that's where that passion came from, for sort of finding that sustainable practice operations that looks after our patients, but also keeps the doors open and helps us confident in our decisions. So now we're going to jump over to Jess, and Jess is going to actually take us through a lot of those key learning points that we spoke about this morning in the slides there. So we always get to this smooth, switch over here as Jess starts sharing her screen. As a tech company, this is always just the smoothest moment as Jess starts sharing her screen. Jess, I can see your screen, which is awesome.
Yeah,
I'm going to be monitoring the chat. It looks good. I can see it. You got some data there. I'm going to be in the chat. So if you have questions, chuck them in. We'll either save them for the end, or if I kind of can find the right moment to interrupt Jess when she's on the flow, I'll ask that question. But please feel free, because the more interactive we do, the better. Jasmine says they can't hear anything, so maybe reconnect. Any problems, maybe hit us back in the chat. But Jess, take us through the wonderful things that you wanted to show us today.
Amazing. Thanks so much, Chris. So I'm sure everyone can see my screen now, but if you have logged into Cubiko before, I'm sure you'll see kind of a similar screen. So this is our home screen. The first thing that you'll see here is we do have a couple of metrics just on that home page. This looks a little bit different depending on your role in the practice. So if you're a nurse joining today, you might have a different set of metrics. If you're a practice manager or a GP owner, you might see something similar. So we do customize those ones depending on your role in the practice, just because that kind of makes sense. What you're looking at as a receptionist versus what you're looking at as a practice manager is probably very different. So you'll see a couple of tiles there. Really good about these ones too is you can jump straight into these ones. So you can see here that heading. If I click into that one, it takes me straight into that metric there.
And Jess, I'm just going to say here, this is a sample practice, everyone. I could tell if someone in the audience is going to say, oh my God, what general practice has $487,000 in debt? We're using a sample made up practice today. So please don't get obsessed with the numbers. There isn't a practice that I know of that has that much debt that we're showing. This is a sample or a demo practice today, isn't it, Jess?
Thanks, Chris. Yeah, it does say demo,
Yeah.
like the data bit down the
Yeah.
bottom, but you will see some pretty rogue numbers in there. So yeah, feel free to just use your imagination at some of the points in there. It is just generated. So yeah, good shout. Thanks, Chris. Yeah, so you'll see a couple of different tiles there as well. Underneath there, you've got your suggested cabinets. So again, depending on your role in the practice, we kind of suggest cabinets for you to look at in Cubiko as well. Your recently viewed, this is a fun one. So if you are, deep diving, exploring Cubiko, and you're not sure where you were recently, you can see your most recent ones in there as well. And then the last one there, news and announcements. So we are constantly making changes or adjustments in Cubiko or bringing, new metrics out depending on what's going on in the medical world. So it's a really great one to keep an eye on just to see, what's coming out in Cubiko. So you can click on any of these ones and it'll open up like a little window. And you can read a little bit of a blurb about that one there. If you want to jump into, say, the metric, you'll have that option down the bottom here, or you do have that read more. So if you want to read our knowledge base article with a little bit more information, you have, that kind of quick link there too, which is nice.
That's awesome. And I think that's where we found a lot of practices. Like when things last year were changing with CDM or bulk billing or things like that, we had resources right here to help you. So please, I know when I was in general practice, like getting ready for accreditation and things like that, having somewhere to go, hey, Jess, where it's like, oh, cool, broken down, one click explanation right here. We put links there and videos. So yeah, often can be a great little place to start.
Yeah, and I guess we try and kind of stay a little bit ahead of the curve, right? So we try to get things out pretty quickly to help you guys too. So it's a really good one just to kind of, keep an eye on. And then just down the bottom here, just wanted to mention that need help tab. If you are in Cubiko and you need to ask any questions, you do have our email at support. So feel free to chuck, any questions you might have in there. If you're stuck with anything, we're more than happy to help at any time. And then up the top here, our knowledge base article. So if you are deep diving or you want to know more information about a metric, how it's calculated, how you can use that metric in your practice, there's loads of information in there. And majority of the metrics in Cubiko do have a knowledge base article attached. So yeah, lots of kind of goodness in there.
Yeah, and we find like often like practice owners or practice managers or, you yourself being curious, like Cubiko, how do you guys come up with this metric? I know Jess and I had lots of chats when she first, like, how do you calculate that? Having that to go to, like the resourcing can be really useful because, you like to have the confidence to answer the questions.
Yeah, and just like that breakdown. And I like the kind of how you're going to use this metric in your practice, which is quite nice too, because sometimes you're looking at something like kind of like what you were saying earlier. Here's the data. What am I going to do with it now? So it does kind of give you those little tips on the pages as well, which is really nice. And then we do have our live webinars down the bottom here too. So each month we do hold a Connect webinar series. And so we kind of pick a topic depending on the time of the year. So we do have one next week, which I believe is on kickstarting CCMP in your practice. So probably a really good one to jump into as well. So you can easily register for that one from there. And then we do have some role-based webinars that we hold each month as well. So hopefully saving maybe some PMs a little bit of time in training, let us do the work. Get your team involved and get them coming along to those webinars because we do tailor them to that specific workflow depending on your role in the practice. Because like I was kind of saying earlier, it does look really different depending on your role in the practice. Like a reception and nurse team, they're not going to be doing the same things. So it's just really tailored to what they'll be seeing and what they'll be doing and using Cubiko for there too. So that's, a really great tool, hopefully for you guys as well. Now I'm going to jump in, just if I scroll down the bottom here. So just into our today's clinic metrics here.
And just can I tell you a story about today's clinic metrics while that one comes up? So
I would love to hear a story.
Today's clinic metrics, everyone, literally started in our practice of everything we looked at today in our clinic. So when Jess goes into this one, you'll see there's a lot of metrics here. This was stuff that every morning in our practice, in Brizzy, when we started Cubiko, these were things we were looking at every day. So don't think it's just some crazy list we came up with. This is actually stuff that we know practices use every day in Cubiko. So it can be a great place to start. Really solid and we keep iterating on it. But yeah, from a really good place, I used to click around BP 10 different places to check every morning to look at this and this and this. I love seeing it all in one spot. So much quicker. And it works super easily also on your mobile if you want to do it on the way into work.
it's kind of good because it guides you, right? So it's like,
Yeah.
what should I look at this morning? And it kind of all lives in one place, which is nice. And there's a couple of metrics in here that will be, more for reception staff or more for nursing staff. So even as PMs, you have that opportunity to delegate some of those ones too. So you don't have to, hold on to anything, because obviously we know that, it's pretty busy in general practice, and I'm sure you guys are wearing lots of different hats. So yeah, kind of a good opportunity to delegate some of that stuff there too. So the first one that I'm going to look at today is that first tile, which is our My Medicare eligible patients with an appointment today. Again, this is typically one that we would see on that reception workflow, just because they're obviously checking in the patients. They're kind of the face of the clinic there. So it's probably a good one for them to kind of monitor. This list is basically all of those patients booked in, coming in for an appointment today. They haven't registered with My Medicare with your practice, but basically flagging them as being eligible. So they've had those 2 face-to-face visits in the last 2 years. So down the bottom, you've got that list, so you can see their appointment date and time, so what time they're coming into the practice, how many face-to-face visits they've had in those last 2 years. And you can also resort this list. So if you want to kind of look at those that have had the most, I guess, visits in the last 2 years and maybe most likely to register for My Medicare, you can kind of rejig those lists that way too.
So Jess,
You
just
can,
to make sure I was understanding that one correctly, like you just sorted that then by F2F visits in 2 years. You're saying that that top patient there on the list there was 7, that patient's had 7 appointments with this practice in the last 12 months, but isn't registered with My Medicare in this practice. So obviously then
that's right.
having 7 appointments, they're going to be like a frequent patient, probably worth the effort to get them involved. That's just make sure I've got that one. Yeah, perfect.
Yeah, exactly right. And yeah, I think maybe that might be easier in starting that kind of conversation about My Medicare with those patients if they are coming in, a little bit more frequently to the practice. And, it might be, giving them that form to fill in while they wait for the doctor, or there might be that QR code that you scan and fill in on your mobile phone, or however your practice is kind of, yeah, I guess, registering your patients with My Medicare there as well. Up the top here as well, you do have a little upload CSV, which actually lives at a couple of different places. But this is just basically so that if you do have maybe a more senior receptionist who's doing kind of dealing with those My Medicare patients in there, what this does is you can download a CSV file from Proda with your most up-to-date list of patients that are registered with your practice. And what this does, it writes back to best practice for you. So that little box in BP that you can tick to say that that patient's registered, it basically does that on your behalf. So you can kind of see your most updated list of My Medicare patients. But it does work in the same way. So if you have any patients that have unregistered, that are no longer registered with your practice, for whatever reason, it'll untick those patients too. So you, instead of kind of having to find out when you go to, do something and realize, oh, that patient's actually not registered with My Medicare with us anymore, it kind of allows you to have that most up-to-date list of your My Medicare patients at the practice. Which is
Can I ask in
really
the
nice
chat,
as well.
who's been uploading that list? I know this would have been a bit hit and miss, but who's been updating their practice database with our patients? So Melissa just had a question, but yeah, I know it's been a bit different, but how often would you recommend we write back, we do that process? So Melissa, Jess, how often do you think? Let's see if we get the same answer. I'll let you go first.
I was going to say weekly, but what are your thoughts?
Yeah, so I used to say weekly, and then with the changes that came in with the GP CCMPs, and that can sometimes be a bit of a blocker to the billing of it. I know some practices that have updated that to more frequently. It just depends on the size of your patient cohort and how many other practices are in your area. If you're the only practice in your area, they're not going to be registered somewhere else. If you're in a really busy location with lots of practices around, I've heard of those practices that do it every morning. So use the one of the best ways I like to look at this is, when you use the tool to upload, it tells you how many records you've had to change. And if you're doing it every day and nothing's changing, well, you might be overkilling. But if you're doing it every week and it's hundreds of changes, maybe do it more frequently. It's an amazing task to delegate to someone. Make it someone's responsibility, make it part of their weekly checklist and have it happen there. So yeah, a bit of a mix in the chat there, but sorry to interrupt, Jess. I just thought that was an interesting one about how people might be doing it across the network.
I think you're right. I think that really is really dependent on, the type of practice you are too,
Mm.
because it might not be super relevant for someone to do it, every week. It might be more of a fortnightly thing, but I will show you some stuff a little bit later on in terms of Quick Check, which is kind of looking at some of those My Medicare registrations alongside those CCMPs, which hopefully will blow your mind. So I'm just going to head back into today's clinic metrics there. So next to that one, we have our unconfirmed appointments today. And again, this is one that I feel would be delegated maybe to reception, and because it is on their kind of workflow, they have access to this one too, but just a really good one. So it's just basically the list of those patients that have yet to confirm their appointments. And what I love about this one too is you can actually see if they have a DNA history in here. So you can kind of focus on those maybe frequent DNAs to the practice, whether that be an extra phone call or just making sure that they are in fact coming in. You do have some filtering within those tables too. So if you want to, really focus on maybe those long appointments, so those double appointments or those procedure appointments in there as well, you can narrow these ones down. So if you just really want to focus on those with a DNA history that have booked a double appointment, because, that's probably a little bit more frustrating for doctors if they're wasted, 2 appointment slots in there. We really want to ensure that they are in fact coming into the practice there as well.
I
So
love
that's a
that
really good
DNA
one.
rate one, because in our clinic we used to be double booked. There was days people had
Yeah.
chockers diaries. Same for you, Jess. And it's like
Yeah,
we could say to our
100%.
GP, we know we're going to have to double book, and we know that you hate that we're double booking you, but we've done it in the slot with the patient most likely not to show up today. And look, they might both show up. They both might show up, but I found that culturally people really appreciated that little step, because it was not it meant that we'd thought about the impact on our practitioner, on our nurse, on our doctor, or double booking them, not just done it. But we'd also done it in a logical way that said, look, this patient has a 20% history of not showing up. So we have to double book because someone's coming back with an x-ray. We put it into that slot. So that's a little tip that I love to use in a practice. It really makes you oh yeah, you guys are across this. That's why you've done it.
I love that. That's a good tip. So yeah, there's that one there too. So, and you can see at a quick glance how many do have a DNA history in there too. Just before I do jump into possible service opportunities and Quick Check, I'll just have a quick look at our clinic utilisation today. And this is basically how booked up we are in the practice today. So a really good one to have a look at, because we obviously want to make sure that our doctors are nice and busy and that everybody's kind of happy in the practice there as well. So you can kind of see at a quick glance, we're sitting at about 50% for my doctors there today. And when we are looking at possible service opportunities and some item optimization, we're going to look at some opportunities to book those patients in for services there as well. But at a quick glance, you can kind of see that utilization by those different roles in the practice. So your allied health, your doctors, your nurses, your utilization by practitioner. So if you have set any targets for your doctors as well in your settings, it will measure against the targets that you've set for those doctors there as well. Down the bottom, so you can see some utilization over the past 7 days in that trend line there. And then we do have some non-patient facing hours by practitioner today. So things like any admin related kind of appointment types, or if they've made themselves unavailable in the appointment book as well. And then just your unbooked hours by practitioner today there as well. Just a reminder that we do that data extraction overnight. So if you have started kind of filling up that appointment book or booking them in and then realizing that your utilization isn't changing, that's just because we only do that data extraction overnight. So it won't kind of show that change in that utilization metric in there as well. Just in case you're filling your books and you're going, why isn't my utilization changing? That's why. And then looking at how we could potentially reach out to those patients or get those patients in for those services. So possible service opportunities lives in this tile here. And again, these are your patients that are booked in for appointments today and what they might be potentially eligible for. So we are looking at that billing history in your PMS software and flagging what those patients may be eligible for. So things like your CCMPs, reviews, your nurse items, health assessments, etc. And you can see across the top here, we've got our summary, which is basically everybody, and all of those kind of different, I guess, areas are included. But if you do want to kind of hone in on specific areas, you can click those tabs and it will just show you a list of those patients that are eligible for each of those ones there as well.
One of the things
But
I'll just say, Jess, is don't try and do it all when you first start. Like,
yeah.
it can be really exciting. And like, when we first built this, people were like, I'm going to try and do them all at once. And I was like, you are drinking from the fire hydrant. It's too much.
Not
You can't
realistic.
change it all
Yeah.
over. Exactly. So like, if you're just starting off, maybe we start off by just doing over 75 health assessments. Or maybe we start off, start of the year, so we're just doing CCMPs. Like, that is an awesome win, because this is delivering amazing care for patients, but it can be pretty overwhelming trying to do it all at once. So the sort of key there is to pick what moves the needle in your practice, don't you reckon, Jess?
Yeah, exactly. And it's not also necessarily about like booking these services in on the day as well. It's also about just starting those conversations with those patients. Why you're already seeing them, you can kind of see what they're eligible for. It might be an opportunity to start that conversation and then, get them booked in from that consultation as well, which is nice. And it is about that kind of proactive care too. So, in this table here, so like I said, it's a summary of all of your patients coming in for the day. So you can see their appointment date and time, who their appointment's with, the appointment type, and of course, your patient. And then here we have that list of opportunities here as well. So this is where we're kind of looking at their billing history to see they haven't had a health assessment or a CCMP done in that period of time, and we're flagging them as eligible for that service in that list here.
And for the ones that say potential new CCMP, that's actually looking at a clinical flag as well. So some of our original Cubiko users, maybe Charlene, who'll be using it for a while, we used to just do billing, but looking at those new CCMP patients, that's looking at clinical flags and conditions there. So it's not just billing history anymore. It's diagnosis and reason for visit and things like that will have patients there because of that sort of flag there. Now, we know the list might not be as long as maybe other software or queries you've developed over time. We got a lot of feedback from users and GPs that said they want, rather than 20 people who might be eligible for CCMP, but they might not be, they prefer 4 really solid ones. Really solid. So we've developed the criteria to find patients there with a lot of GPs. So just remember the CCMP ones and the COVID boosters and the vaccination also use some clinical data, which has been something really cool we've been rolling out there as well. So particularly for the new people, I thought that was a good one to highlight there, Jess.
Yeah, thank you for that. And also just to mention that that's for BP customers. So for Medical Director and ZMed, it is looking at just the billing history. We just don't have the same kind of access to those tables in the back end to be able to produce that kind of clinical information. So it is for the BP customers that are flagging something, potentially like an underlying condition, etc., in there as well. So thank you for reminding me, Chris.
No, it's just I just see some names here that I'd seen in big customers for a long time, and I remembered that originally we did it, and I just thought, I should make that clear for the few people who are long standers. That was a really big moment for us.
Yeah, it's amazing. And I was actually just thinking when we're looking at item optimization, there is like a little column in there that kind of flags those ones for those CCMPs, which we will jump in and have a kind of a quick squiz at as well. And for our medical directors and med customers as well, with this list, you can download this list as a CSV and print that list. You can log out. You can print preview that entire list as well as the open in new window. I feel like this is such a fave, especially across our nursing team and our doctors, but basically it shows you that same list here, just in a kind of a pop-out window form, and it just basically starts off from those new patients or those patients from the start of the day down to the last. And it is color coordinated. You can kind of see at a quick glance what those patients are eligible for. So it's kind of a good one that you can keep open even over, BP to see what those patients are potentially eligible for and, start those conversations. Or, the nurse might go, oh, you're due for your flu vaccine. I might grab you after that, appointment with the doctor and get that one done while you're in the clinic today, etc. But this one does stay open too. So you can click out of Cubiko completely and just keep that pop-out window open, and it doesn't need to be refreshed. So it will stay open for that 12 hours as well, which is quite nice in there. And it's color coordinated. We love color coordinated. I feel like my eyes are like,
pretty,
that's beautiful. Exactly. And now I'm just going to quickly give you a bit of a run through of Quick Check. So Quick Check is only available to BP customers, and it is an add-on. So if you don't see Quick Check in there, you can sign up to Quick Check in the settings area there. But essentially what Quick Check is doing is running a bulk check to see if our CCMP and mental health care plan items, so the same check that you do with PRODA, just to ensure that those patients are eligible for that service. So instead of kind of jumping in and doing that individual search for those patients, you're able to do it in a bulk way, which is quite nice.
Big
So
time saving. Yeah.
This is the one where I'm like, I used to have CCMP nurses or CDM nurses back then, and we used to do this really manually every morning. And I used to think, oh my God, the time that we would have saved if we weren't jumping in and checking all of these patients individually. Quick Check pretty much pays for itself in that instance. And then, so yeah, in that Quick Check column today, you'll see things like no items, and that just basically means that the patient isn't eligible for any of the items that we're able to check with Quick Check, because we are only looking at those CCMP and mental health care plan items there. At this stage, health assessments aren't available, but it is really high on our wish list. So, one day maybe.
I send an email every quarter to the government saying, please let us have it. Believe me, I do it in my room. Yeah.
That's what I mean. I'm like, we're definitely working on it, guys. Don't worry. And then you can see if Quick Check's been run for the day. So if it says no, it means that we haven't run Quick Check for those patients. So I'll do a quick run now, and we'll see those ones change to that green and yes. So it's just making sure that like anyone that's jumping in can see, okay, Quick Check has been run for today before we kind of send those opportunities or make sure that those patients are in fact eligible for those services. I'm just going to select a few because we share this demo data, so I'm sure the sales team will kill me if I don't leave any in there for them. So I'm just ticking a couple of ones there. And then I'm just going to hit Run Quick Check so I can see that button's become available. A little declaration is going to pop up, and this is the same declaration that you get in PRODA, just to say that you've got patient consent. And then I'm going to hit Confirm. Depending on the size of your list, it'll take about 30 to 60 seconds. Once it's been run, you'll see that kind of green tick to say that Quick Check has been run for those patients. So if I scroll across, I can see that opportunities list has now been updated. So if I hover over that legend, I can see if it's bold, it means that they're verified as being eligible. If it's crossed out, it means not eligible for that service. And then standard is based on your billing history. So when we're looking at those health assessments, etc., we're looking at that patient's billing history there to basically flag them as being eligible.
So just that second one down, see potential new CCMP has been struck through. My way of thinking about that is, this patient has a clinical condition or a billing history thing that sort of said, Cubiko has said, we think this patient may be eligible. When it's gone away and we've done the Quick Check, it's come back and we've struck it through. So that normally means probably it's been billed somewhere else. They're not eligible according to the government to have that service. So in my world, how good is that? Like, you're not going to have the whole process kicked off and done and then not be able to bill for it. Saves so much time and resourcing. That to me is a magic moment of how this can really help. But then the 2 lines down, that patient is bold and no strike through. So they will be eligible. So that's awesome for them as well.
Exactly right. And so quick, right? So it happened in 30 seconds and we've gotten all of those responses back for those patients. So amazing. And again, stopping it before you kind of, you do the time and you see the patient, you do all the things, and then to realize that you can't even bill that item number in the practice, and you don't find out until you're doing your rejections. So yeah, a really good tool. And then just down the bottom here, you do have your Medicare responses as well. So you can see if it then weren't verified, you can see why they weren't verified for that service as well. Similar to when you do an OPV check and they're not verified, you can kind of see, why. But a really good one too with this one is if we are looking at those CCMP item numbers and running that eligibility check, if that patient is registered with another practice for My Medicare, it'll also come back as not being eligible. So it's a really good way to kind of identify any of those patients that on paper look like they haven't had that CCMP done. They haven't had it done in another practice, but they are registered with another practice for My Medicare. So they're not actually able to get that service done in the practice. And it basically will update in this column here. So I don't think demo data actually has anyone, but you'll see a red cross in this area, and it'll basically say registered at another location. So you're going to be able to quickly identify, although eligible, they're registered somewhere else with My Medicare. Therefore, we're not able to provide that service to the patient.
Yeah.
So
and that means you normally have
that's
to have a chat to
amazing.
them, hey. Yeah, but it's also the reason we show you not eligible, the location rather not eligible, is that they might be your patient, and for some reason they've registered at another practice. So, have a chat to them and find out, oh, you're registered somewhere else. That's sort of, it's less of a no and more of a, you might want to look into this. Don't you reckon, Jess?
Yeah, let's have a chat about that. Yeah. And sometimes it's hard for patients. They might not even realize that, that's happened, or what they were filling in, or whatever it might be. So, yeah.
Exactly. And now, before you jump to care prompts, Rajan had a question about patient consent, saying, do we call or can we have it as part of our patient registration? So we know there's lots of different ways practices do this. The way I see most common these days is it's now part of the new patient registration and the patient new patient sheet, and also your practice policies. And it's not just saying for Cubiko. Most practices will do it with some wording around, we will use tools like Proda and Cubiko and things like that to provide care for you. Do you consent? If you jump online, you can find lots of different wordings. The RACGP and their new patient form, pretty sure, has some wording too around. You're going to use a number of tools, not just Cubiko. You might be using different things throughout your practice to provide that proactive care. And so you're getting that consent and having that in there as part of the new patient form is the easiest way. But it's up to you and your practice. Different practices do it different ways. Just important you have that process. And Susan, I'm sorry we can't do it for MD yet. I keep trying. I keep trying. Don't believe me, I keep trying. But at the moment, just the BP. But sorry to interrupt you, Jess. I think you're going to show care prompts, or I can't remember what you were going to do next. But yeah.
I was going to say, I look after a lot of MD practices, and yeah, we are definitely trying to go prompts because I want it too. But yeah, so basically now we've kind of run quick check. We can see that those patients are eligible for those services, and now we're going to run or send care prompts. And what sending care prompts is basically sending this list or this information in that opportunities list back to best practice. And then basically, yeah, I guess everyone in the practice can kind of see quite clearly what those patients are eligible for. So really getting it across to the clinical team what their patients are eligible for. So it does do a right back into your appointment book, which is awesome. Down the side here too, I just wanted to pop out these filters, just because if you do want to filter down those opportunities, you can pick and choose which ones you want to send. So if you are really focusing on, one kind of, I want to do my CCMPs this week, you can choose to just choose those patients in there too, and just to send those ones back. Same there, if you don't have all of your doctors, they don't all want to see care prompts, you can select particular ones from that list too. If that's kind of, some doctors want to, view it themselves, maybe open up that pop-out window. Some are happy to have it in their appointment book. It kind of gives you the flexibility to kind of customize that too. And then up the top, you can save any of those filters. So if this is a filter you're going to run every single day, you can save and then load that filter each day too, which is quite nice. Oh, and just make sure you reset your filters too if you are jumping between metrics, because they do stick. I found that out a lot. But yeah, that's a good one too. And now sending care prompts, I'm just imagining that I left my filters on and I'm sending that information back to BP. So you can select your entire list or individually. I'm sure you'll probably send it back for everybody. But then I'm just going to hit that button there next to the run quick check, send care prompts. This will basically pop up to say, are you happy for us to write that data back to BP? Just going to hit confirm and then confirm there. Depending on the size of the list, it can take a couple of minutes. But then once it's gone through, we can see that one there. Sometimes you will get an error because we do that data extraction overnight. If that patient has deleted that appointment or cancelled that appointment and it no longer exists, it basically doesn't have anywhere to send that information. So you will sometimes see that error there. And what this kind of looks like in your appointment book too, so it will appear on those patient details there, but it will appear in the waiting room for the doctors and also next to the patient appointment too, so that you can pick it up from the waiting room and the appointment book in there. Oh, fab.
So good. It's changed the game, those care prompts. Like, so many practitioners just every morning now want to see in their
what
diary,
they're
in the
doing.
book.
Yeah.
Exactly. But I think once again, you hit it there, Jess, really well. Don't send them all. If you send everything, you saw this big long list that patients might be eligible for, people stop reading it. So maybe just do for we've seen since the change to CCMP a huge shift to that more proactive. And I know you're about to talk about that soon, Jess, the proactive or the opportunistic chance to provide CCMP.
Yeah.
That really is this great way to pray. Like, this patient is eligible. It's been 3 months. They've booked in for 15 minutes already. A lot of our GPs have really been using that as like an opportunistic moment to provide the CCMP review.
Yeah, and like you said earlier, we don't need to do all of the things at once too. So even cleaning it up a little bit kind of makes it less overwhelming for the doctors too. So, and even, start that conversation with the team. What do we want to focus on this month? Like, let's do that, or, whatever it might be to kind of suit your practice too. Which is nice. So we will kind of jump in and look at item optimization. So next door, we have clinic optimization here and under item optimization. So this is very similar to possible service opportunities, but this is a way that you can, like Chris said, kind of reach out to those patients opportunistically. And so they might not necessarily have an appointment booked in. So in the filters here, it does automatically filter all of those patients that would be eligible for these different services. So things like your CCMPs, health assessments, and then you've got some other opportunities down the bottom here, like your nurse item numbers, your medication management reviews, mental health care plans, etc. But you can filter this down to just look at patients that have no appointments booked. So we might want to reach out and service those patients that aren't yet booked into the practice there, which is quite handy. And you can also toggle on your RACGP active patients in there as well. So if you really want to focus on, your kind of regular patients to the practice, you can turn those ones on in the filters there too. So it's just going to filter all of those patients in there. These all look quite similar when you're jumping into them. So if I jump into move from CDM to CCMP, it'll basically give me, how we kind of, deemed them eligible for that service. You can see how many of those patients are sitting in there and how much that would equate to if those patients were, in fact, billed that item number there. And then you have your total list of those patients down the bottom here. So obviously we can see it says no bookings because we've filtered it down to those patients that don't have a booking. We can see their last attended appointment when they last had that service, the amount of days since that service there as well, who they saw, and you've got a couple of extra ones there, like your My Medicare status, etc. But what I really do like as well, if you do have a couple of nurses who are kind of looking at this and actioning it, we do have an actions column in here as well. So it's kind of a way to kind of communicate within Cubiko what people have actioned and what they're looking at, etc. in there too. So if I've actioned all these ones, I might pop a little action in there. So if somebody else jumps in, they can look and say, oh, okay, these ones have been actioned. If I hover over, I can see it was updated by me at the date and the time as well. So you're kind of not doubling up on reaching out to those patients as well, which is quite nice. And the tables are customizable in Cubiko. So if you want this to move anything, you can kind of drop it or drag it around. You can also
I love
pin
that
anything.
feature. Like, it was only added probably in November last year. So there's a few, Cubiko users on the call.
Yeah.
You can now move that column to the very left and hide the columns you don't want to see. And so make these tables all your
drag
own,
them,
and it'll remember it when you come back. So you can reorder these tables, resort them, and next time you load this page again, it'll be in that same order. So made it heaps easier. I know it was a bit of a pain point for people. So that's really cool. I know a lot of practices will put like patient or actions as the first column and make it stick.
Yeah. I love the pinning it too, so you can kind of
Yeah.
just slide across, right? It seems very like effortless. But you do have that option too. And then you have some filtering within like the tables there as well. So you can filter down different ways there too. So lots to do in those tables. But you can also export this list. So if you do decide I want to do a bulk SMS, you can export as a CSV file, drop it into that third party like HotDoc or AutoMed, and you can send out that bulk broadcast to those patients too. So you can really reach out to those patients and get them booked in that way too, which is nice. I might jump back to my today's clinic metrics. I know I went a little rogue there, but those two kind of coincide with each other.
Yeah.
So it's kind of nice to kind of jump in and kind of talk about together there as well. Next one on my list, my outstanding debt. This figure changes daily. It always look sometimes a little bit, oh, look, I jumped in and it was like $500,000. So hopefully your demo data doesn't, your data doesn't look as ridiculous as mine, I'm hoping. But basically you can see a really great overview of the outstanding debt at your practice. And in here as well, down the bottom, you can also toggle on to include your Medicare and DVA services as well. So if you're wanting to look at both your Medicare and DVA debt, you can also include it in this area as well. So you can see my total debt, my total amount of debtors, my outstanding invoices there. I can see my outstanding invoices or my outstanding debt by practitioner. If I hover over, I can see where that debt is kind of sitting between that age range there as well. So I might
This is
want to
a
start on
big
my 90+ days because it seems like there's lots sitting in there.
And Jess, I find like for practices that are with their service fees, they're being calculated on receipted. So the money the practice is actually, or the patient, not the practice, the money the patient has paid. I know a lot of practices moved, maybe 10 years ago, they were doing on bill to being paid. One of the things people forget, and particularly when it's so hard to get doctors at the moment, and they might be looking at what they earn in your practice and maybe what they earn in other places, is that until the practice receives those funds, they're not going to be part of the service fee settlement process. And I know there's lots of nuance around it. You go with me on the process of those words here, but if the service fee is being calculated on receipted or paid, that money's not going to be included. So you could have doctors that are doing a lot of work and for some reason they weren't batched, or they're in debt, or their work cover hasn't paid, or work choice haven't paid. Their pay packet, for lack of a better word, their total billings when they look at receipted is going to be lower. And it's been quite sort of heartbreaking when I talk to practices and they say, oh, we bill really well per hour, but our GPs felt they had less take home. It's because the debt was sitting there and they weren't, getting the money on receipted. So one, to definitely run maybe a day or two before you calculate your service fees to definitely make sure they're up to date here. A really good tip there to help make sure that our practitioners are getting everything they're owed.
100%, good shout. Really great tip there too. But yeah, we do have that total list of our outstanding invoices and also your outstanding debtors there as well. Again, this might be maybe a senior receptionist job to jump in and just make sure that we're clearing anything or following up on any of those outstanding invoices as well. In this list, you can see, obviously the patient details, what they came in for, the MBS item, how much is owing, and probably my favorite is you can see if they have a next appointment booked in as well. So, that might be an extra note on the patient's file to say, make sure you follow up on that debt when they come into the practice, or just making sure that we have that conversation with the patient next time that they're in, just to settle, they'll finalise that debt when they do visit us as well. I do love that next appointment booked in. It would have saved me so much time when I was doing these things.
I used to go and look up their appointment, like go and look up patient, open a patient, and you can see their, I spent so much time doing that. It just saves so much time.
Individually. So
Love
that's an amazing one. And then just quickly down the bottom here, we have our shared health summary uploads as well. So each clinic has their own kind of magic number, which I'm sure you all know. You can set that target in our settings area too. So when we are looking at this metric, it will measure against the target that you've set for the practice. So really great to just be able to see at a quick view, how you guys are going. Do you have enough uploads for that quarter? Do we need to kind of, hustle a little bit and get over the line? But there's a really good ones down the bottom. So we can see our shared health summary by our practitioners. You can see that trend line there. So when we're kind of doing those uploads, you have your list of uploads there. And then again, one of my favorite ones, we do have patients with an appointment in the next 3 days with no recent upload. So these might be the patients that we, have that conversation with and get those, health summaries uploaded for those patients that are visiting our practice. In the next couple of days, which is nice. I like to favorite this one just so that I can have it at a quick view. So any of the metrics in Cubiko you can save. So if you hit those 3 dots, mine says remove because I've already favorited it, but it would say add to favorites, and then you'd be able to pick that up from this area here, which is quite nice. Oh, it went all the way home.
Now we have 10 minutes left, Jess. So just to time check you. So I might I think we've been answering most of the questions as we go. So let's keep going. But if you do have questions, let's keep using this time, but check them in the chat. And Jess, you keep going. And thank you so much for sharing these great tips with us.
I've only got a really, just this line here.
Keep going. I'll keep it on the chat. Yeah, exactly. Totally. That was me trying to be subtle, but I probably did that like a sledgehammer. So apologies.
No, I'm keeping a little eye on it, so I do know. But some of these, are quite self-explanatory too, so they don't need too much explanation, luckily. I did save those ones for last for this exact reason. But we have our recalls. So anything yellow in Cubiko with an exclamation mark is representing anything urgent. And then you have your non-urgent down the bottom here. So just a really great snapshot view of our recalls at the practice. How many we have, again, who they're sitting with, what that kind of age of that recall is as well. And then down the bottom, we do have our count of recalls. And because we love lists in Cubiko, we have a list of our recall patients there as well. So you can toggle this down. So if you want to, I guess, first thing of the day, maybe focus on those urgent recalls that we need to contact and get booked into the practice, you can toggle that down by that recall type there as well. So just like our outstanding debt, you can see if they've got an appointment booked in. So again, this saves your nurse a lot of time, so they don't have to jump in and check that in the appointment book to see if those patients are booked in. We'll be able to quickly see at a quick glance when they're coming in for their appointment there as well. A really good one here, if you do have patient contacts turned on, you can download patient contact details. So if you're using this list directly, it will basically import a couple of extra columns with patient contact details. So their mobile number, home number, work number, and an email address in there as well. So if you do have a voice over IP system, you can actually click the number and it will actually call the patient on your phone as well, which is
That's
pretty cool.
Awesome. I love that one. We only added that one last year, but it's made life so quick. You just click on that number and it dials it for you. That's awesome.
They love it. They love it. So that's an amazing one there as well. Next to recalls, recalls appointments to be rebooked. So if patients have booked in that recall appointment type and they've either DNA'd that appointment but we haven't rebooked, basically patients will show in this area. So just making sure that patients don't fall through the cracks there and that we are following up with those patients. Unactioned inbox items, these are those pretty self-explanatory, all your items that are sitting in your inbox that we do need to action there as well. So basically you can see how many of those unactioned inbox items your doctors or practitioners have. You can see the total number there. And then down the bottom here, you can see all of that information in there. So you can see obviously the practitioner, the different titles in there, so where they've come from, and you can see if that patient does have a next appointment booked in, etc. as well, and where that's stored into, so investigations, your correspondence, etc. So again, just keeping an eye on these ones, just in case, there might be something, urgent in there that does need attention. And obviously we don't want to have kind of a bit of a crazy number sitting in that outstanding inbox items for that reason.
Great when like registrars have left or you've had staff changeover and things end up in a random inbox and haven't been able to keep an eye on it. Like that's where I really found this useful. It's like, why is there stuff in this inbox that doctor or that registrar left like 6 months ago? That's one of the reasons I had this one.
Yeah, and then again, if someone's gone away and then we're realizing, oh, we actually didn't set up that buddy system, but we need 100%. All of these things.
Yeah. Oh, kept me up at night, those sort of things. So it's good to have them covered.
Absolutely. And your investigations contacted, not given. So we've made contact to the patient, but they basically haven't been marked off in the system there. So just ensuring that we are kind of finalizing that last step and acknowledging that we obviously gave that patient those results there as well. Lastly, just our overdue reminders. So obviously these are your kind of routine reminders that are sitting in your PMS software. I'm giving you a bit of an overview of those ones there as well. So how many we have sitting there, your overdue reminders per practitioner, your total list, and then some really great filters in here too. So you can filter down by those different reasons there as well. So again, if we're wanting to focus on particular areas, you can absolutely do that from this section here as well.
That's
I know
awesome.
I've talked a lot, so we'll throw to some questions now.
You probably need a drink of water. So do you want to stop sharing? I'm going to share some resources and then we might have time for some quick questions as well. But Jess, thank you so much. That was so a lot. I love seeing those little things and remembering how we use them in our practice and thinking how the practices might be able to use them. I always find it just so invigorating for my brain. So, but can you see this one now, QR code? Is that one coming up? Give me a thumbs up, Jess, if you can see that one.
I can see it. Yeah.
Perfect. So as Jess mentioned at the start, we've given you a lot of information and that's probably like only like a 20th of what Cubiko could do. But we find some of the best ways to learn is based on your role within the practice. You want your nurses coming along to a webinar to learn about features that nurses love. You want your doctors who are so time poor coming along to learn about doctors. So doctor uses of Cubiko. So if you scan this QR code, there's a few coming, but yeah, there'll be a few. Scan this one. It lets you register for our role-based webinars. So how to help based on the role within the practice. Just so I mentioned that we do these monthly Cubiko Connect webinars, and these are more topic-based. So we might be doing one like we are next week around CCMP, or we might have one coming up on changes to this, or different ways to use things. So they're much more about a role. Really good if you're trying to stay in touch with what we're doing or thinking about some quality improvements in your practice, and pick topics that are useful to you. You can also watch the recordings. I love this one, our Learning Hub, because there are courses there. There's a course just for your doctors, a course for nurses, a course for receptionists, and one of the great ones is a new to Cubiko course, a little 2-hour course that you can do to learn all about Cubiko. So many practices tell me that they've made that part of their onboarding process now. So whenever a new receptionist starts, you don't have to spend an hour and a half teaching them how to use it, an hour teaching them how to use it. You can send them, there's videos, there's links, and for accreditation, which I know is everyone's mind, they do count as administration CPD. So you can use it for that as well. Who doesn't love killing two birds with one stone, getting two things off, getting a learn about Cubiko and having something ready for accreditation? Just showed the knowledge base and all the awesome resources that are there. So if you're not getting QR coded out, this is the link to that one there as well. So all the common questions, I love using the typing in things there to find out the answers to that as well. Now, we are so excited to be working with the PHN. It's an amazing relationship. I'm super grateful for every day. So if you don't have Cubiko in your practice, reach out to your practice support officer, and they can give you some more information about how your PHN, your amazing PHN, who very kindly let us come and chat to you today, and we're supporting so many practices in your area. I love it. You can help with your Cubiko there as well. So we are finished with 5 minutes left for questions, which is amazing. Well done, Jess. I feel like you've kept us on time there when I've waffled. Does anyone have any questions? We can put it in the chat. The questions are, can we get a recording? Yes, I was told there is a recording, and maybe if some of the PHN crew want to join us now, there will be a recording. Certificates, I can't help with, Melissa. That's above my pay grade. Yes, I could pass over to someone for the PHN on that one.
Yeah, we will send out certificates, and also it is recording. I believe it's going on a different site to our normal PHN site. So once we get that, we can forward that on.
You can relive the moments. It's a highlight reel of Jess and I's on stage banter.
Performance.
So that's cool. And I think they've just chucked a link in there to the survey. So say nice things. It helps us make ourselves better and improve how we do things. Oh, and a QR code. What more do we need? There's no too many
Amazing.
QR codes, is there? Any other questions? Anything we didn't cover? Yeah.
Maybe they're all typing.
They're all typing. That's exactly. Oh, we just did such a great job. Oh, look, thumbs up from Rajan. I thank you for that one. That's lovely. Thanks, Melissa. Excellent as always. So it's such a delight to get to talk to people and see how we can help. We have some awesome stuff planned this year. You probably saw at the end of last year, we started including a lot of clinical data in Cubiko, and you can now do your PIP-QI in Cubiko and a few other things. So we have some awesome stuff I'm super excited for in the pipeline this year. It's going to make just running practices easier, and most importantly, help your wonderful patients. That's our real mission here. So thank you so much for coming along today. I'll pass you back to the PHN crew, and it'll be a pleasure talking to you all.
Thank you. A massive thank you to Chris and Jess for presenting. It was amazing. As Chris mentioned, I've just popped the link and a QR code in the chat for you to complete the evaluation. That would be great. That's all from us. So thank you so much, everyone, for joining.
Amazing. Thanks so much for having us.
Thank you.